Bariatric surgery, that's a term you may have heard. It's been around for a long time, but with recent advancements, do you know all of the benefits you could receive from it? Today, we're joined by Dr. Eric Crable. He's a bariatric and general surgeon with Trinity Health to learn more. Good morning, doctor.
Thanks for having me. Yeah.
Absolutely. Who qualifies for bariatric surgery? Specifically, what does it do?
Yeah, great question. So, we have a lot of different prospective patients that could achieve benefits from these opportunities. BMI ranges are kind of a big topic we need to discuss.
Body mass index,
Correct.
That's what that is, okay?
Yep, so in that BMI range 35 to almost 40, oftentimes patients need at least some other medical issues involved. So that would be type 2 diabetes, high blood pressure, high cholesterol, as well as sleep apnea.
Okay.
If your BMI is over 40, technically that's all we need. So we know at that stage the disease of obesity has set in, and there's going to be other ramifications down the road unless we deal with it.
So if that BMI is between 35 and 40, obviously something you might want to talk to your doctor. 40 and up, you're a candidate for bariatric surgery. Okay, and so how does it work? What does it do?
So robotic and laparoscopic surgery are kind of the mainstays in how we approach this. Oftentimes we're removing or altering parts of the gastrointestinal tract to help restrict capacity that patients have with portion control, and sometimes altering the absorptive or malabsorption process that can achieve weight loss.
Now, many people have heard of GLP-1 and tirzepatide and semaglutide and a lot of these things going around. How is that affecting what you do?
It really goes hand in hand, obviously, in caring for patients dealing with obesity. However, we do want patients to realize that there's limits to all treatments. So oftentimes, if you're prescribed this medicine by your doctor, we're not discouraging its use. We want patients to understand that there's a scope or a breadth of care that can be achieved with this medicine. So oftentimes we need to see patients in that BMI 30 to 35 range are maybe going to benefit the most with these medicines. But really once we get to that BMI 35 and beyond, we're really trying to help out some of those comorbid conditions. So that, again, that's the diabetes control, high blood pressure, high cholesterol that can lead to further cardiovascular disease, where surgery is going to be potentially a better option.
When you use words like comorbid, I think that's definitely something that perks somebody's ears up. Say, maybe I should look into this. If you know your BMI, well, if you don't, good time to check one out. But if that BMI is 40 or higher, you're already a candidate. 35 to 40, you might want to be calling your doctor. TrinityHealthMI.org/bariatrics for more information if you want to request a consultation with a bariatric surgeon.